Testing for the hip joint requires tests in all three planes of motion. The hip is capable of flexion, extension, abduction, adduction, medial and lateral rotation. So we'll need our clients in a variety of positions in order to execute these different tests. From a supine position, we're able to execute a good test for hip flexion and a good test for hip adduction. So we're going to start with those two to begin with. For hip flexion, we're going to bring the hip into hip flexion, knee bent. Right, so we're going to be at 90 degrees. This will be where we test the strength of the hip flexors. We're going to place our hand on the top of the thigh, proximal, close to the knee. We're going to push into hip extension and instruct them to push back into hip flexion. All right, so Victoria, I'm going to place my hand here. I'm going to push your thigh back down to the table, and I want you to push it back towards your body, okay? Just take a deep breath in, deep breath out, and push. Great. So this hand is here just for support. I'm not doing anything with this hand. All the push is here and just meeting her pressure. So that's the test for hip flexion. We're going to bring the leg back down, and now we're going to test for hip adduction. To do that, we're going to bring the legs together and start them to squeeze and hold them together. Try to make sure they don't go too much into any rotational patterns when they do that. We do want the thighs to be relatively neutral. And simply, we're going to place our hands, pull one side, this side is just being stabilized, one side into abduction and have them fire back into adduction. So then we instruct our client. So Victoria, we're going to hold your legs together like a vice, okay? I'm going to place a supporting hand on this leg, and on your right one, I'm going to pull or attempt to pull the leg away from the other. All you're going to do is squeeze the hip and keep them together, okay? So take a deep breath in, deep breath out, and go. All right, so there we have a test that very clearly, and she did great with just letting that go. A lot of clients will go into other places, they'll fire other muscles, those things will happen. We just got a clear low-grade result from that test. Right, so we have hip flexion, we have hip adduction. Now, for hip abduction, we're going to put our client in a sideline position. So I'm going to have you lay on your side, please. All right, we're going to bend this knee forward for support. Okay, so our testing hip is up. We're going to put them into abduction, have them hold the leg there, and then we'll push it back down into adduction for the test. All right, so Victoria, I'm going to have you hold your leg right here for me, okay? I'm going to push your leg back down to the table, you keep it up, all right? Deep breath in, breathe out, and push. Good, and I'm going to have you go face down. So with that test, you don't want to keep them there too long, right? The leg's up in the air, you're really forcing their abductors into an isometric contraction. They're having to fire, so you don't want to keep it there too long, okay? The last three tests we have is for the hip extensors, the medial rotators, and the lateral rotators. So we'll start by testing hip extension. So the target hip is here. We're going to bring the knee at 90 degrees, okay? And we're going to instruct our client to raise the leg off the table and hold. So I'm going to support that for now since I'm talking so she can relax into me. So from here, with the leg and slight hip extension, we're going to push back into hip flexion and have them resist. So Victoria, when I move my hand, I want you to keep your leg here for me, okay? I'm going to push it back down to the table, and I want you to resist up towards the ceiling, okay? So I'm removing my hand, hold that hip up. All right, deep breath in, deep breath out, and push. Relax, good. So I keep my hand in the lower back just for support and also to feel any sort of changes in the lumbar or sacral position as compensation for that test, okay? So one hand in the lower back, one hand at the thigh, close to the knee, proximal, and then push down into the table. All right, last two tests are for rotation, so we'll go back to 90 degrees at the knee. All right, just remember from this position that although we are moving the leg medial, the hip is actually rotating lateral, okay? So here we have medial rotation of the hip, here we have lateral rotation of the hip. All right, these tests can be done from neutral, okay? So I'm going to start by placing my hand on the inside of the foot. I'm going to be pulling into medial rotation, and she will be firing into lateral rotation. So I am testing her lateral rotators with this particular test. So hand on the inside of the foot, I'm going to instruct my client. So Victoria, I'm going to be pulling your leg this way, right? You'll feel your hip turn. And I want you to push through your hip, your foot into my hand and resist, okay? So take a deep breath in, deep breath out, and push. Great, so that's a test for the lateral rotators. The second half of that test, again, I'll be placing my hand on the outside of the leg here, really the outside of the ankle. I'll be pushing into lateral rotation. She'll be resisting by firing her medial rotators. So this is a test for medial rotators. So hand in the lower back, my opposite hand on the lateral side of the ankle, and I'll instruct my client. So Victoria, I'm going to be pushing your leg in through the hip, and I want you to fire it back into me through the hip, okay? So take a deep breath in, deep breath out, and push. So there's our test. Relax. So we covered all 3 planes of motion in the hip, all 6 movements. Hip flexion and hip adduction we did face up. Hip abduction we did on the side. Hip extension, medial and lateral rotation we did prone, face down.